back to the Power Breakfast Show. Now, I'm sure in your life you've come across someone who has fibroids, or you've heard the term fibroids. What are they? How do they affect us? What are the symptoms? Well, in studio, I'm joined by Professor Stone, who's the first word is very hard, but I'll just say a gynecologist.
That's right.
And then Florence, who has been through that whole process of having fibroids and having them removed. And we're here to talk about what exactly they are and what's the way forward. Is it life-threatening, or is there life after, you know, having my fibroids removed? Welcome, guys. Thank you very much for coming. And the first question would be to you, Professor Stone. What exactly are fibroids?
Well, good morning, Kirigo. It's as you say, it's a very common condition, and most people will have a friend or a relative who has been affected by fibroids. And it's really a growth of the muscle cells of the uterus. And typically, one or a few muscle cells in the uterus seem to just grow more than they should. And normally in the body, the cells have mechanisms which stop the cells growing more than they should. But for some reason, that control mechanism is lost, and the muscle cell just gets bigger and bigger. And that's what causes fibroids. And
it affects women, of course, and what ages? And then I was doing research, they say it affects us more. Is that true? Black people of black color.
That's absolutely right. It's a common condition for women in general, and often starting probably in the early 30s. We do see patients who even have got fibroids in the mid to late 20s, but it's really age 30 onwards where it starts to be more common. And as you say, there is a racial difference. They certainly do occur in Europeans and in people of Indian origin or people of Chinese origin, but they seem to be particularly common in people of black ethnicity.
Yes.
We don't know why that should be. It seems it's one of those research questions which is so far unanswered, but it certainly is true that fibroids tend to occur younger. They tend to get bigger. And maybe be more numerous in black women compared to white or Indian or Chinese women.
Yeah. What are some of the symptoms one would go through when they have fibroids on them?
Again, that's a very important question to focus on, because for many women who may have a fibroid within the uterus, it's actually not a problem, and it actually doesn't cause any symptoms. And remember, this is a benign condition, it's not a cancer.
Yes.
So for many people who may, for example, have a scan or have it just picked up in some other way, coincidentally, they may not have any symptoms. And in that situation, very often, in terms of medical advice, we'll be saying, well, actually, it's a small fibroid, it's not causing you any problems, don't worry about it.
Okay.
And that's a very important piece of advice,
yes.
that not all fibroids cause symptoms, and in fact, not all fibroids need treatment. For people who do get symptoms, which usually means that the fibroids are more numerous, or they're bigger, or they're quite close to the lining of the uterus, the main groups of symptoms, first of all, would be period problems, especially very heavy periods, very heavy flow during the menstrual period, passing clots, and maybe even getting anemic. And the other main group of symptoms is pressure symptoms, or just being aware of a big swelling in the tummy, or maybe having to pass urine very frequently because of pressure on the bladder. So those are the two main groups of symptoms. They're not usually very painful. In some people, the pressure symptoms can start to cause pain, or periods can be more painful, but quite often it's actually not that painful.
Yeah. Let's come to you, Florence. You had fibroids, and you didn't have any symptoms, do you?
I didn't have any symptoms, and I didn't have anything that would have worried me at that time. It's only when I started realizing that I'm having my abdominal is getting large, and I thought, let me just check it out with my doctor, who confirmed through ultrasound that I had fibroids that were quite enlarged.
But initially you just thought it was you putting on weight and, you know, after giving birth, and you're just thinking it's a normal process.
Yeah, I thought it's normal, and I was actually trying to work it out, how I can lose weight and to reduce the bulkiness on my abdomen, and I did a lot of exercises and crunches, but this was not going.
It was not going at all.
I remember my friend saying to me, you do a lot of exercises, but you're not losing weight
around the abdomen.
Yeah. So that's when I thought, let me go further and check it out with my doctor.
Did you go through any pain?
I had a lot of menstrual, during my periods, I had a lot of pain. And I thought, again, this is normal. And I kept taking painkillers, thinking this is going to go after I finish my period. And a lot of heavy bleeding. And again, this went on for 2 weeks. And then after that, I think this is normal. But when I began to get tired, I get tired because after the period and you've lost so much blood, I felt this needs to be checked.
Let me ask, when you were cramping, because we usually go through that as women every month just before our periods, do you mean you were cramping for the 2 weeks and then after that it goes? Like it were normal cramps but just more severe?
More severe at the beginning for 5 days. That's very, very severe. And then after that, I wouldn't feel any pain, but there's a lot of bleeding. And that goes on for 2 weeks. Then I kept saying, because of age, this could be normal.
Yes.
And I just lived with it.
Dr. Stone, if I'm in that situation and I don't know about it, and I stay with my fibroids, is it fatal?
It's not. It's not likely to be fatal, but it can cause some health problems if things get really bad. And probably anemia is a really serious problem that does affect many women in Kenya, that the periods are so heavy that people are losing so much blood that the body just has difficulty making up the blood.
Yes.
And people get very, very anemic with very low hemoglobin levels, which really results in things like breathlessness and difficulty in going upstairs. And that's really a bad, has a really major impact on health. And that's something that, again, people, because it comes on gradually, people can get really bad without really realising, and they think, oh, well, it's just, I'm getting older, etc. And actually, when we do the blood test, we think, wow, this is terrible, get them into hospital.
And let's get this done.
And you think, how did you manage to walk around with such a low level of hemoglobin?
In your system.
So in terms of pressure, again, sometimes the pressure symptoms can get really bad. If the uterus gets almost, right up to the rib cage, like a term pregnancy, again, that starts to cause breathing difficulties, and there can be pressure on the kidneys, which can start to cause health problems. But that's really in the extreme situation when the fibroids are really huge.
I should have asked this earlier, but what's the difference between a fibroid and a cyst?
Yes, that's a good question. And sometimes, as doctors, we have some difficulty distinguishing between the two. And the cyst is usually, it's a swelling usually on the ovary. And again, that's a rather different condition from the fibroid. It's not a growth of the muscle, it's a growth of different cells within the ovary. And sometimes we can distinguish the two quite easily from examination, but sometimes we're not sure, and sometimes we use things like ultrasound to help us figure out, is this a cyst or is it a fibroid?
Yes. Now, I discover I have fibroids. What's the next step? Of course, come to hospital and you'll give me certain procedures that I can do. Maybe you could tell us what's available for us.
Okay. Getting a good medical assessment is obviously quite useful, and I think Florence has illustrated that point quite well.
Yes.
People sort of think, you've got a feeling that something's not quite right, but you're not quite sure what it is.
Because we tend to suppress the pain we go through, it's not that serious.
And I think also, women are heroic and tend to put up with things, and often, things get quite extreme before a woman would actually go and seek help. And sometimes I get the impression, actually, sometimes even friends and relatives are not necessarily helpful. Somebody's complaining and they say, oh, wow, it's just one of those things.
Just take some painkillers.
And I think, again, addressing any men who might be listening, again, I think men have a responsibility to make sure that their wives or sisters or daughters actually get proper assessment and get the help that they need when they're in these kind of difficulties. But the assessment includes things like ultrasound to figure out how big the fibroids are, how many of them are there, and then it would include blood tests to see whether anemia is part of the problem or not. And then it's really a question of coming up with recommendations based on the patient's age and whether they've completed their family or whether they still want to get babies. And it's also important to bear in mind that for people who are in their late 40s or even early 50s, we can expect that the problem will solve itself, because as we identify that somebody's quite near the menopause, and usually the average age of menopause is 50 or 51, then so for example if somebody's 51 and is already getting some other symptoms of menopause like hot flushes or sweating, and maybe the periods are becoming irregular, we might be able to say, well, hang on a minute, let's not do anything because probably these periods are going to stop. And typically when people reach the menopause and periods stop, then the fibroids do shrink naturally. So it may not be necessary to have any treatment if one has already reached that stage. But having said that, the age of menopause is very variable. So there are some women who are still, 52, 53, 54, still having very regular, very heavy periods and might even still need treatment. But the age is certainly a major factor in giving advice. And as we were emphasising earlier, the smaller fibroids that are not causing symptoms, often the advice after doing a scan perhaps and checking that the blood tests are all right, we might just say, well, actually, this is not going to cause you a problem, just leave it alone. But then if it's more than that, then we move on to the various treatment possibilities.